One of the companies involved in all this, in this really international effort, is a Scoreboard Small Business Spotlighter, Zephyr Technology. Now, the company supplied the device that allowed doctors above ground to monitor the vital signs of the miners below the ground. With us now is the CEO, Brian Russell. Good to see you, Brian. Also here is Fox News medical contributor, Dr. David Samadi. Good. Congratulations to you, Brian, for the work that you did. How did your technology play into what happened today?
Well, really, David, we got contacted by the New Zealand Embassy and also our local distributor down there that works with the military. And so a few different people came to us when this all happened because they couldn't get normal hospital-based equipment down there. So they had an 8-inch hole. They needed equipment to get down there, and ours worked.
Okay, let me just hold on one second, Brian. I just want to alert our viewers that we are looking at live pictures. Once again, you don't have to turn the channel. These are live pictures of the rescue attempt. Again, the 29th out of 33 miners have been rescued. Now, let me just, for those who don't remember, Brian, summarize what you do. You have a pack that you put around your chest that monitors all the vitals, and it's by remote control, correct?
Yes, we do. So we have a strap, or we put it into people's clothes. We have an electronic puck and then a piece of fabric, or this can be a uniform of people. So this is what we shipped down there for the whole team. It was taking part in their training regime for the last 70 days to keep them active and healthy. And then through a fibre optic link attached to the capsule, the doctors were monitoring them live as they came up.
And the point, I guess, was if somebody's heartbeat was really too fast and a dangerous level, you'd be either able to give him a sedative down there or perhaps to hold off on him, sort of talk him down, calm him down until his levels came down to the point where he could be transported to the surface. Is that right?
You've got it absolutely right. And also they could give them pre-medication before they came up. Also, given that we were monitoring them for 69 days, the doctors had a very good understanding of how each individual was performing down there. And so that helped them actually set each individual up in a personal way before they came up.
All right. Now, doctor, to me, it sounds like, to a novice like myself, this is invaluable information that the doctors on the surface are getting.
Incredible technology. You look at this as like a GPS that you can put on the patient and you can monitor the vital signs, heart rate,
Yep.
blood pressure, skin temperature, and the future of this is extremely bright because as physicians, we can actually monitor our patients at home. We will be able to have this Bluetooth system where the patient can be monitored, and I would be in my office and know exactly what this is going.
Would you then be able to self-medicate, tell the patient how to self-medicate and take whatever drug is necessary? Or?
Well, look, the future, David, the future of medicine is extremely bright. As you know, I'm in the world of robotic surgery, remote control surgery. 10 years ago, this was a crazy idea, but
maybe
today,
from a policy perspective, the future is not so bright. From a technology perspective, though,
standpoint,
it's great.
It's pretty amazing. I think the fact that these miners were coming up on the surface about 2,000 feet, being able to monitor their blood pressure. One of the things that can happen from bringing them up is that their blood pressure can collapse. Having this kind of monitors to be able to monitor their heart rates, their blood pressure is extremely important.
Is this because of the pressure difference?
Exactly right. And
so this would lead to then the bends, the classic case of the bends, somebody coming up from underground.
Absolutely right. Because they've been in a static position and now they're standing, the blood pressure can actually collapse. This trip was about 30 minutes.
You put them then in a hyperbolic chamber, an oxygen tank, essentially, to get them back to normal?
If that happens, then obviously you have to monitor them with IV fluid and bring their.
By the way, Brian, do we know if any of the miners who were brought up today had to have that happen? They had to be put in an oxygen tent?
Not to my knowledge. We've been monitoring them long term, but the miners have asked for all medical diagnosis and so forth to be kept secret. There is discussions that we'll be sharing it with NASA. NASA hasn't obviously been able to get permission to do this type of experiment, and so it's going to be invaluable for things like deep space as well as home healthcare.
I understand the need for privacy, but it does appear, anyway, from my perspective, that everything's going pretty well, right?
We have been astounded both how the psychology of the miners has been amazing. At the beginning, they didn't want any sensor on them because they said, "Hey, look, we're healthy. We don't need medical devices." But the head physiologist down there has used our system for a long time. He negotiated with them and explained to them long-term monitoring can actually prevent something bad happening. And so they said yes, and actually started to enjoy it a lot, particularly during their hourly workouts each day.
Well, Doctor, not only is this great from Brian's perspective, because his device is obviously taking center stage here, but from the perspective of what we will be able to do when accidents like this happen again. I mean, this is a blueprint now for us, is it not?
To me, first of all, he should be congratulated for this kind of technology. I actually studied it before coming on air, solely because the firefighters, the U.S. Army have been using it, and we're able to actually not put the doctors in the dangerous way and be able to monitor their heart rates and blood pressure from remote control. This is certainly going to take off. Certainly in a position like this has been very helpful. And I think the physicians and the rescue workers should be really admired and congratulated for the job that they have done. Every one of these guys that are coming out, it's a goosebump, and you can see
every
it's
single time.
Unbelievable.
Doesn't get any less
This
exciting.
is a medical miracle, and it's as a result of not technology, but the teamwork that all the doctors have putting together to take care of this.
By the way, Brian, this is the last thing from our minds right now, but you are a businessman. You got to think about this. I mean, do you see a big growth in Zephyr as a result of this?
Oh, absolutely. And to your earlier point, maybe the infrastructure may get in the way of this. We need to take part in the infrastructure, but this type of technology, particularly with the sort of smartphone apps that this comes on with things like Android and the iPhone, it allows the consumers to actually go direct, get the data themselves, and then choose what they give to the doctors. So I think this is a very enlightening, and it adds to the freedom of every potential patient out there.
Fabulous stuff. Brian, congratulations. Again, you do deserve a lot of credit here. Of course, it is a business, but again, it's a business that you're pouring your heart and soul into, and it certainly paid off in big time today. There's just spectacular results. Brian Russell, Zephyr Technology CEO, and Dr. David Samadi, great to see you from Mount Sinai.